Hello everyone, this video is about MNT, Medical Nutrition Therapy for Gestational Diabetes. So in this video, we will be looking at developing the nutrition care goals and nutrition recommendations for gestational diabetes, and also looking at the MNT strategies and dietary approaches for women with gestational diabetes. So before moving on to gestational diabetes, we would look at the ideal weight gain during gestation. So the weight gain that should happen during the pregnancy depends on the pre-pregnancy BMI. So if you look at this one, for example, if a woman was in the normal healthy weight category before being pregnant, that is from 18.5 to 24.9 kilograms per square meter, their total weight gain during pregnancy would be 11.5 to 16 kilograms. So this weight gain includes the total weight that would include the fetus, amniotic fluid, and other maternal organs. So everything. So if somebody was underweight before becoming pregnant, they are having they're having more allowance for weight gain. They can gain from 12.5 up to 18 kilograms. But if the woman was overweight or obese before becoming pregnant, they cannot gain much weight. So they are having lower values. So if somebody's weight gain is higher than what is recommended for based on their pre-pregnancy BMI, that could be associated with higher risk of adverse maternal and infant outcomes. So this is if they are bearing a single fetus, but for twin and triplet pregnancies, these values would be a bit higher. For example, if a woman was in the healthy weight BMI category pre-pregnant, then and they are now bearing twins or triplets, their weight gain recommendation would be higher than before, now with 16 to 24 kilograms. Earlier it was 11.45 to 16 kilograms. So likewise, depending on the pre-pregnancy BMI, there are different recommendations for the weight gain during pregnancy. Then looking at Australian dietary guidelines, these guidelines are for all pregnant women, irrespective of whether it is not specific for those who are having gestational diabetes. So as we know, there are 5 food groups. So this is the recommended serve sizes from each of these food groups. If this picture is not clear, I recommend you to go to this Eat for Health website and you can have a look at these values. So these values are a bit different for normal women and pregnant or breastfeeding women, and also that differs based on the age. And also the Australian guidelines recommend to limit the intake of foods or drinks containing saturated fats, added salts, and added sugars, and also alcohol. And they encourage and support breastfeeding. So these are the guidelines for pregnant women, not specifically for gestational diabetes. Then talking about additional energy requirements during pregnancy. So for a pregnant woman, we first have to calculate the energy requirement based on how we would do for a normal non-pregnant woman. We can use different equations, and these different equations, you will be learning them in the MNT course, and the equation we can use differs from situation to situation, and you will be learning all of them. And if some woman is pregnant, we have to add a certain amount of extra energy, and that depends on the trimester. So there are 2 organizations giving these recommendations, and I'm going to explain you focus more on these IOM guidelines. So according to IOM, if a woman is in the first trimester, we are not adding extra energy, but according to NNR guidelines, they are adding 103 kilocalories, which is not much, which is very small. So these 2 different organizations have don't have much differences. And in the second trimester, we would be calculating the energy as how we're doing for a normal non-pregnant woman, and then we will be adding this extra amount, which is in kilojoules. It is 1422 kilojoules. And for a woman who's in third trimester of their pregnancy, we are adding an extra energy content of 1891 kilojoules. So the basic idea here is that even though a woman is pregnant, they are not eating for two. We are not multiplying the energy requirement by two. Instead, we are just adding a smaller extra amount as shown in these different recommendations. So now I would be talking about different nutrition care goals. So I have divided that into three categories. The first one is risk reduction, like what kind of a diet we should be following, or a woman should be following if they want to prevent gestational diabetes. For example, if the woman was having a high risk of developing GDM, as we have discussed in another video, like if they are having higher BMI, higher pre-pregnancy BMI, or if they are having, if their age is greater than 40 years, or if they are in a particular ethnic group that is having high risk of gestational diabetes, then they have to follow a diet to reduce the risk or to prevent the onset of gestational diabetes. And the second category is for somebody who's already diagnosed with diabetes, gestational diabetes, what should they eat? And the second one is after delivery, what kind of a diet, like for a mother who had gestational diabetes and then they have done the delivery, and what kind of a diet they should be following after that. So these are the three categories. So we will go through each one of them. So the first one is about primary prevention, that is to prevent the onset of gestational diabetes. So I have taken these different evidences from peer-reviewed published literature, and also I have given the references. So if you feel like you want to read further, you can search for these different references, these sources. So the first one I've taken is a systematic review and a meta-analysis. As you know, systematic reviews have higher level of credibility than a single research study. But still, this study says that the people who, these women who have followed different pre-pregnancy diets or physical activity interventions, but they didn't have any significant difference in their outcomes like GDM, preeclampsia, gestational hypertension, preterm birth. So this one says that although they have followed different specific diets or specific physical activity interventions, there was no significant difference. But still, these individual studies could have different limitations, and we still have to read further about these different interventions, what kind of things that they have controlled for, and what specific interventions have they followed to come up with these results. So if you are interested, you can go further and read. But I've taken another important, another study like that. So this study says pre-pregnancy dietary patterns and the risk of gestational diabetes. So they are showing us associations. For example, for women who followed a diet with fruits and low-fat dairy products and having more cooked vegetables, and also more cooked vegetables, they were associated with less risk for gestational diabetes. And those who ate more saturated fats, meats with saturated fats, and snacks and sweets, they had high association with gestational diabetes. So in simple terms, fruits, low-fat dairy products, vegetables were shown to be good, and the meat, snacks, and sweets were bad when it comes to GDM prevention. And the Mediterranean style diet was having lower associations with the gestational diabetes risk, which means Mediterranean style diet is better. And also generally healthy diet that is rich in vegetables, whole grains, nuts, and fish, and low red and processed meats is the one that is best to prevent the GDM according to this study. So In here, helpful diets would be the Mediterranean style diet. That would be high in fruits and vegetables, legumes, olive oil, cereals, fish, and having limited animal products. And also DASH diet, dietary approaches to stop hypertension, that is originally developed for hypertension. But that type of a diet has also shown better results when it comes to preventing the onset of gestational diabetes. So DASH diet is having things like high intake of fruits, vegetables, legumes, and nuts, moderate low-fat dairy products, and low consumption of sodium, animal proteins, and sweet. So according to this this study, DASH diet has been better than the Mediterranean diet, but if you see these components of each one, they are mostly similar. So a generally healthy type of a diet with more fruits and vegetables and more unsaturated fats, and lower sodium, low sweets, and low saturated fats would be better in preventing the gestational diabetes. So again, this says, based on the healthy eating index, a diet that is high in legumes, nuts, cereals, vegetables, fruits, omega-3 fats, polyunsaturated fatty acids, and limiting the intake of red and processed meats, sodium, sugary beverages, and alcohol, that would reduce the gestational diabetes risk up to 46%. And if you can combine this type of a diet with other factors like physical activity or avoid smoking or maintaining the body weight, that could further reduce the risk of gestational diabetes onset up to 83%, as that is shown through this study. So diet and early mild moderate exercises were the ones that are effective in GDM prevention. So that is about preventing gestational diabetes, preventing the onset of that, especially for those who are having higher risk of developing GDM. And the second one is for somebody who has already been diagnosed with gestational diabetes, because we need to try to treat the gestational diabetes to prevent the consequences like macrosomia and many other consequences that we have discussed in a previous video. So we need to control the gestational diabetes with a proper diet to prevent all these different consequences from happening. So dietary intervention along with glucose monitoring. So we do the intervention and we keep monitoring the blood glucose levels. So that is the best choice. And so for those who are failing in the dietary modification, they would go for insulin therapy. So in summary, a few things that we could do to treat the gestational diabetes. One is dietary counseling, and the other one, restricted calorie intake. That's a bit tricky because we don't always recommend restricted calorie intake in a way that would reduce the weight. So we can discuss more of that in coming slides. And low carbohydrate diet, DASH diets, low GI diets, and in combination with aerobic or resistant exercises of moderate intensity, those are suggested as treatment methods for GDM. And if you want to know further, you can read through this article. This is the one that's giving these different ideas. So now we've already looked at the energy recommendations during pregnancy. Although we don't have specific energy recommendations for gestational diabetes, we know the energy recommendation for pregnancy. That is, we calculate the pre-pregnancy values and we add a certain amount depending on the trimester they are in. Now we're coming to carbohydrate recommendations. So this slide, this table shows you the different recommendations given by different organizations. And this is about the quantity of carbohydrates. So after reading through all of them, according to Queensland clinical guidelines for gestational diabetes, we should aim for carbohydrate intake that achieves 175 grams per day. of carbohydrates, and that should be divided evenly throughout the day, and also that should be tailored to individual needs. So as I said earlier about dietary restriction, if a dietary restriction can cause a weight loss, that is not recommended. So a dietary restriction that is sufficient to cause a weight loss is not recommended. Then coming to carbohydrate threshold, how low can we go? Because people are trying to go for low carbohydrate diets when it comes to when it comes to uh, uh, controlling for gestational diabetes. The recommendation, according to Queensland guidelines and also for IOM guidelines, is 175 grams per day. And as I said before, that should be divided evenly throughout the day. And we can tailor that according to individual needs as well. However, some women may tend to consume lower carbohydrate diets, that is less than 175 grams per day of carbohydrates, or if we talk in terms of percentage of energy coming from carbohydrates, less than 40% of energy coming from energy intake coming from carbohydrates. So if somebody is having, we don't have fixed value for this one because different guidelines tell us different values. 175 is the one that we can follow based on QLD guidelines and the IOM guidelines. But if somebody is having a very low carbohydrate diets, that would be inadequate to meet the needs. So that would slow the fetal growth. That is one thing. And the effects that a low carbohydrate diet would have on maternal ketonemia and plasma fatty acids triglyceride levels, that still remains unclear, because we could argue that if somebody is trying to reduce trying to reduce the percentage of energy coming from carbohydrates, that would eventually increase the percentage of energy coming from fats. And or else they're trying to replace the carbs with the fats, because the total should be 100%. And if we try to reduce the percentage that is coming from carbs, that should increase from somewhere else. And if that increases from fats, does it have any effect on the plasma triglycerides free fatty acid levels? That is something arguable, and that still remains unclear. And also a recent recent RCT tells us that having lowering the carbohydrate levels below 165 grams per day could result in the risk of micronutrient deficiencies. Now looking at the guidelines of Academy of Nutrition and Dietetics, for all pregnant women, they recommend a minimum of 175 grams of carbohydrates. And also they have a recommendation for proteins, that is 71 grams of proteins or 1.1 grams per kilogram of body weight per day of proteins. And they recommend 28 grams of fiber per day. And that is about the quantity of carbohydrates. And when it comes to types of carbohydrates, they recommend having low GI, low glycemic index, or medium GI diets. And also they recommend DASH diets. And also they have a recommendation about the maternal weight gain, that, as we've discussed earlier, that depends on the pre-pregnancy BMI. The weight gain, the amount of weight gain would be different. And when it comes to weight gain, suppose a woman's recommended weight gain is 11.5 to 16 because they were in the healthy weight BMI category before pregnancy. And if they have already exceeded that recommendation, when they are coming to you, if they have already exceeded that recommended weight gain, that targeted weight gain, we are not trying to limit the energy intake. We are not trying to bring about a weight loss, but we try to just maintain the weight at that level. What we are not trying to do is we are not trying to lose the weight, even though they have exceeded that target value. Then talking about the role of glycemic index in the treatment of GDM. So it is recommended to have low GI diets because that could reduce the postprandial glucose and insulin responses. And evidences from RCTs and meta-analysis, randomized controlled trials and meta-analysis suggest that low GI diets can lower the blood glucose levels, reduce the gestational weight gain, and decrease the need for insulin therapy in women with or who are at the risk of GDM without going for adverse maternal fetal outcomes. And also, it suggests that low GI diets are associated with differences in neonatal, that baby's fat distribution or the central adiposity. So that prevents central adiposity. However, the clinical significance, this still remains unclear according to this study. So carbohydrate quality is more important. So although we were worried about carbohydrate quantity earlier, carbohydrate quality, that is depending on the GI, fiber, and the source of carbohydrate, that is important rather than the total carbohydrate intake when it comes to gestational diabetes maintenance. So the third category is post-delivery, that is after delivery. So for a woman who had gestational diabetes during their pregnancy, it is important to focus on weight after delivery because that is a predictor of future diabetes. So this study identified different dietary patterns and how that is associated with the weight gain or weight loss. So the healthy types of dietary patterns, that is having a generally healthy diet with more fruits and more vegetables and low saturated fats, low sugars, and also having a DASH diet is associated with less weight gain. And a high risk diet pattern, for example, one that is having more ultra processed foods, high caloric foods, or high sweetened beverages, that results in a higher weight gain. So we always need to focus on controlling the weight gain after delivery. So it is recommended to follow healthy dietary approaches like DASH diet, Mediterranean diet, when it comes to reducing the risk of hypertension after post GDM pregnancy. And breastfeeding is also recommended. Even according to Australian guidelines, breastfeeding was recommended. And breastfeeding is having benefits for both mother and the baby, short term and long term, and that helps improving the glucose tolerance and improving the insulin sensitivity and reducing the incidence of type 2 diabetes for mother, and also that helps to reduce the BMI for the child. So that is the end of this video. Thank you.